And so what more can be done to help to close those gaps?
So look, obviously we work with government around what those needs look like. I suppose the third thing that we do is really advocating and giving a voice for country kids. So, we're in there explaining what's actually happening on the ground, the lack of access to paediatrics. Most paediatricians across the state have closed their books or have incredibly long wait lists for children with developmental challenges. Those kids are being sort of deprioritised, for obviously kind of life-threatening illness for children. But we know that developmental window closes down quite quickly. And so, there does need to be more paediatric services in the bush. Allied health services also are really stretched. There's a much greater acceptance of telehealth now, and I think that has to be in the model. Face-to-face is great, and as I mentioned, we're trying to do more of a hybrid approach as well so that we can build trust and we can understand local community context. But the reality is, with the workforce shortages that there are, that we really need to look at all options. And telehealth for kids, we've been doing it since 2014. It works remarkably well for most children, and the frequency and the benefit of families not having to take days off work, taking kids out of school to travel, hundreds of kilometres in some cases for appointments that they might just get once a month or once every 2 months. You're just not going to get the traction there. So with our telehealth into schools, we'll be delivering sessions every single week per term, and for some kids for the whole year. And that makes an incredible difference. And we're seeing, teachers often report explosions in learning for kids that have almost been shut out from learning before, because we can actually address their challenges in the school, inside the school gate, and the model works really well. So there does need to be more access. There needs to be a greater focus on early intervention. As I said, that sometimes the kids that we see in our assessment and diagnosis service, they haven't been picked up until maybe year 1, year 2 at school. So a lot of the kids we see in that program are sort of 8 and 9. And by that stage, they're what might have been a speech and language delay as a young child has now turned into also a mental health disorder. And we see that is such a common trajectory. Children with speech and language concerns are at so much greater risk of mental health issues and disorders later on in life. And we want to stop that trajectory and go earlier. And, the services really need to be set up for that early intervention. And, it's sad to see, when I go to Bourke, and there is such a commitment in the community to the kids. It's just so fantastic to see. And yet you're just so limited by the amount of service that you can access in the town. And it must be incredibly frustrating for the community at times, just not getting the support that they need.
Jackie, thank you for your time.
Thank you so much, and your interest, and thanks to Bourke for having us. It was a great visit.
I've been speaking with Royal Far West CEO Jacqueline Emery, who was recently in Cobar and Bourke. Outback Radio 2WEB.